Hi everyone, Whitney Lowe here from the Academy of Clinical Massage, and today on our Clinical Insights video we're going to be taking a deep dive on an interesting new artificial intelligence tool from Google called NotebookLM. We published a blog post on our website about clinical reasoning and then put the blog post into this artificial intelligence tool, and it created an automatic podcast discussion around it. So I want to share that with you as just one more way to have a chance to listen and consume this content and see what you think about it. So I have my two artificial intelligence avatars, Mike and Dana, here having this conversation and taking a listen to what they said about the article, and then you get some interesting insights about the real nature of what we're trying to get across here with clinical reasoning. Now, one thing I will note is they constantly refer to this blog post as a book. So do note that it is about a blog post, and you can find that blog post here on our website if you would like to read that as well. So let's take a listen to what they had to say about it.
Have you ever had one of those massage experiences where you walk out feeling like a brand new person and others just feel like a nice rub?
Exactly.
We're diving deep today into think before you treat to explore why that is.
Interesting.
These excerpts really get to the heart of why just knowing massage techniques isn't enough, especially for those seeking relief from pain.
Right.
We'll uncover what it takes to be a truly exceptional massage therapist.
Right.
It's not what you might think.
It's fascinating, isn't it?
Yeah.
Massage therapy is changing.
Okay.
It's no longer just about relaxation. There's this increasing demand for therapists who can treat specific conditions.
Right.
Like chronic back pain or those repetitive strain injuries we all know too well.
Yeah.
It's a whole new ballgame.
Absolutely.
Yeah.
And the book argues that the key to this shift is something they call clinical reasoning. So what exactly is clinical reasoning, and why is it so important?
Imagine a detective for the body.
Okay.
That's what a massage therapist using clinical reasoning does.
Interesting.
They don't just apply a standard set of techniques.
Right.
Instead, they gather information,
Okay.
analyze what's going on with you specifically, and then personalize their approach.
So they're taking into account like your history and everything.
It's like solving a puzzle.
Yeah.
Figuring out what's really causing your discomfort.
So it's not just about knowing the techniques. It's about knowing how and when to apply them for each unique individual.
Exactly.
Okay.
And that's where the book throws some shade at traditional massage education.
Interesting.
Many programs emphasize techniques, but don't adequately prepare therapists for this kind of critical thinking.
Oh.
Yeah.
So they're saying there's like a gap.
There is a gap, and this gap has real-world consequences for both therapists and clients.
Yeah, that makes sense.
Yeah.
The book actually uses the example of a shoulder pain protocol, a predetermined set of techniques for treating shoulder pain.
Okay.
But what happens if your shoulder pain isn't typical?
Yeah.
Let's say it stems from an old injury.
Right.
Or poor posture.
Well, the protocol might offer temporary relief.
Okay.
But the problem could easily return because the underlying cause wasn't addressed.
Oh, so it's kind of like a Band-Aid.
Yeah, it's a Band-Aid approach, and it highlights why therapists who rely solely on protocols without that detective work can fall short.
So just following a protocol isn't enough.
Right.
Especially for more complex cases.
Exactly. Clinical reasoning goes beyond memorizing techniques.
Okay.
It's about understanding the body's mechanics, recognizing patterns, and knowing how to adapt based on individual needs.
I'm starting to see why some massage experiences feel so much more effective than others.
Yes.
But this raises an interesting question.
Okay.
The book talks about the diversity of massage therapists. Some coming from healthcare backgrounds, some completely switching careers. How does that play into developing clinical reasoning?
That's a crucial point.
Yeah.
You can't expect everyone to learn the same way.
Right.
Someone with a medical background might already have a strong foundation in anatomy and physiology, while someone new to the field might need a different approach to develop those clinical reasoning skills.
Okay.
Yeah.
It's like there are different paths to the same destination.
Exactly.
But what does all of this mean for someone listening to this deep dive?
Yeah.
What's the takeaway for them?
Whether you're a massage therapist or someone seeking pain relief, wouldn't you want to know that the person treating you is a skilled clinical reasoner?
I would think so.
It's about getting the most effective treatment possible.
Right.
It's the difference between masking the problem and actually addressing it.
That makes a lot of sense.
Yeah.
I'm already starting to rethink what I look for in a massage therapist.
Good.
Yeah. So we've established that clinical reasoning is super important.
Right.
Well, how do you actually develop this superpower? Is there a secret formula or a one-size-fits-all course?
It's more of an ongoing journey than a quick fix.
Okay.
But the book offers some excellent guidance for therapists who want to level up their clinical reasoning skills.
Okay, so spill the beans.
Okay.
What are the first steps?
First and foremost, seek out advanced education.
Okay.
That goes beyond rote memorization of techniques.
Gotcha.
The author suggests looking for programs that use case-based learning.
Case-based learning.
Yeah. Imagine being presented with real-world scenarios,
Okay.
like a client with mysterious hip pain,
Interesting.
and having to figure out the best course of action.
So you have to think on your feet.
Yeah, it's like a mental workout for massage therapists.
So kind of like massage therapy boot camp for the brain,
Exactly.
where you build those critical thinking muscles.
Yes, and just like in boot camp, having a good coach can make all the difference.
Right. A mentor.
Exactly. The book emphasizes mentorship. Finding an experienced practitioner who can guide you, share their insights, and demonstrate what good clinical reasoning looks like in action.
That's such a great point. Having someone to bounce ideas off of and learn from their years of experience.
Yeah.
It's invaluable.
Absolutely.
But it's not a one and done situation, is it?
No, it's not.
What about staying up to date on the latest research?
Absolutely. The field of massage therapy is constantly evolving.
Right.
So therapists need to be lifelong learners,
Always learning new things.
always seeking new knowledge and refining their clinical reasoning skills.
So it's like a constantly evolving thing.
Yeah, think of it like upgrading your software to keep things running smoothly.
This is making me realize that the book itself is kind of like a mentor, offering guidance and a new way of thinking about massage therapy.
That's a great observation.
Yeah.
The authors have even developed their own program,
Oh, wow.
specifically focused on teaching clinical reasoning.
So they're putting their money where their mouth is.
They are putting their money where their mouth is.
Talk about walking the walk. But, this whole discussion has been incredibly eye-opening for me.
Good.
Even as a client.
Okay.
Do you think the principles of clinical reasoning can be applied to clients as well?
That's a brilliant question.
Okay.
And I absolutely believe they can.
Interesting. How so?
Understanding even the basics of clinical reasoning can empower clients
Okay.
to be more active participants in their healing journey.
So instead of just passively receiving treatment,
Right.
we could be asking more informed questions
Exactly.
and advocating for ourselves.
For example,
Right.
let's say you're seeking treatment for chronic back pain.
Okay.
If you have a basic understanding of clinical reasoning, you can ask your therapist questions like,
Yeah.
what are the potential underlying causes of my pain?
Okay.
Or how will your approach address my specific situation?
That's a game changer.
Yeah.
It shifts the dynamic from just fix me
Right.
to a collaborative partnership where you work together with your therapist to find the best solution.
Exactly. By having that open dialogue,
Yep.
you build a stronger therapeutic relationship,
Okay.
which can lead to better outcomes.
So it's a win-win for everyone.
It is. You become an advocate for your own well-being.
This deep dive has completely changed how I view massage therapy.
Good.
It's not just about relaxation anymore.
Yeah.
It's about understanding your body
Right.
and finding a therapist who can really listen and personalize their approach.
It's about moving beyond a one-size-fits-all approach
Right.
and recognizing the complexity of each individual.
Yeah.
It's about informed care and empowered healing.
This all makes so much sense.
Yeah.
But I have one final question that's been bugging me.
Okay.
If clinical reasoning is the secret weapon that makes some massage experiences so incredible, how might the lack of it explain those less satisfying sessions? The ones where you just feel like you got a nice rub,
Right.
but nothing really changed?
That's the million-dollar question, isn't it? And I think it goes back to that detective analogy we talked about. If a therapist isn't utilizing clinical reasoning, they might be missing crucial clues
Yeah.
about what's really going on with your body.
Okay.
They might be applying techniques that feel good in the moment,
Right.
but don't actually address the root cause of your discomfort.
So it's like going to a mechanic who just starts replacing parts.
Yeah.
Without actually diagnosing what's wrong with your car.
Right.
You might see some temporary improvement, but the problem could easily come back because the underlying issue wasn't addressed.
That's a great analogy.
Yeah.
And on the flip side, when a therapist is using clinical reasoning, it's like they've cracked the code.
Okay.
They're able to pinpoint the source of your discomfort
Right.
and target their treatment accordingly.
Yeah.
It's a completely different experience.
It's like they're speaking your body's language.
Exactly.
Understanding its unique needs.
Yes.
And responding in a way that truly makes a difference. No wonder those sessions feel so much more transformative.
Precisely.
Yeah.
And that's the beauty of clinical reasoning.
Yeah.
It's about moving beyond a one-size-fits-all approach and embracing the incredible complexity of the human body.
So if there's one thing our listeners take away from this deep dive,
Yeah.
it's to seek out massage therapists who are skilled clinical reasoners.
Yes.
Don't be afraid to ask questions.
Right.
Do your research.
Exactly.
And find someone who's truly committed to providing personalized care. It's worth it.
Absolutely. And if you're a massage therapist listening,
Like,
I encourage you to reflect on your own practice. How can you further develop your clinical reasoning skills?
yeah.
It's an investment in your clients, your career, and the future of the profession.
This deep dive has been a real eye-opener.
Good. I'm glad.
I never realized how much goes on behind the scenes of a truly effective massage.
Yeah.
Clinical reasoning really is the secret ingredient.
It is. It's fascinating, isn't it?
It really is. Well, thanks for joining us on this deep dive into Think Before You Treat.
It's been a pleasure.
Until next time, keep thinking critically, keep asking questions, and keep exploring the amazing world around us.
So I think this technology is truly mind-blowing, and there's all kinds of implications for what we can see happening in the world of education and information sharing around doing something like this to consolidate complex aspects of an interesting topic. Again, like they mentioned, we do dive deeply into clinical reasoning processes in our case-based training programs at the Academy of Clinical Massage. So come join us over there. Take a look at academyofclinicalmassage.com. We'd love to have you join us over there. We'll see you in the next video.